Thanks for tuning in to tRNsform Nursing. I'm Harmony, and today we're going to see what the life of a nurse is like. So stay tuned to see. Good morning, everyone. It is 6:18 in the morning, and I am going to do my hair and makeup. Hey guys, so hair and makeup is done. Scrubs are on. Lunch bag is packed. It is 6:44 in the morning, and I'm going to get ready to walk over to work. Hey guys, it is 6:51 and I am walking over to work. My husband is being a doll and walking me over. It's, a balmy, I don't know, what, 40, 20? Okay, 20. I was off by, half of the degrees. But, yeah, so 6:51, walking to work. Got to get there by 7. All right, see you then. Hey guys, it is about 8 o'clock in the morning. I made it to work on time. I've assessed all of my patients and I got bedside report. So now I'm just getting ready to start my AM med pass. I'm going into the patient sunroom right now and was walking down the hallway. This is just a nice place where patients can spend some quality time with their families while they're hospitalized. Hey guys, so it is about 8:45 and I have finished my med pass on my 5 patients. This here is a typical patient room that is currently empty, and I did a quick zoom in on our code buttons so you can see what a normal room looks like. Hey guys, so it's Harmony. It is 9:06 in the morning, so I got report and I was a little bit off to a late start, so I got floated today because it is, wait, I don't know if you see it, Happy New Year! So today's January 1st, so my unit was closed because of the low census, so I got floated to a different unit, which is always fun. The struggle is real. I knew none of the codes. I didn't know where anything was, medcart, whole shebang, but I'm here. It's, like I said, it's probably like 9:07 now. And I have my overnight oats that I'm gonna be eating. And of course, you have to say highly caffeinated as a nurse. So that is just my coffee for the day, and I'm just gonna take a quick break. Going into work can sometimes be stressful, and especially when you get floated, your first like 5-10 minutes are rough. Trying to figure out a whole new floor, a whole new unit and everything, but you just gotta roll with the punches. So sorry, I had to get off before someone was in the bathroom, and I was like, don't want to catch them recording. Not like it's anything bad, but it's kind of awkward. So today I have 5 patients. It's a med-surg oncology patient, so they're here with a chemo, or they're here because maybe they're a new diagnosis and they're getting like biopsies. And because today is January 1st, there's no like procedures or anything because the elective procedures won't be done today. But I do have one person going home, so I might be up for an admission, so I'll see how that is. Hey guys, so I am in the clean utility room. The struggle is real. I have no idea where anything is, but I'm just going with it today, and I'll keep you in the loop. It is 10 o'clock, so yeah. So something really interesting just happened. I was getting ready to discharge a patient, and they were on a medication called sotalol. And sotalol is a beta blocker, and you need to do like these crazy EKGs 3 hours after when the person's on sotalol, brand new. Well, this person's been here for 5 days, and the doctor's never ordered the sotalol. So I'm doing the discharge, and it's, resume your sotalol. You can't just resume this medication because like you need to get EKGs, it could stop your heart. So, I called the doctor and they ordered the meds, they ordered tele for the patient, they delayed the discharge until like tomorrow or the next day. But that's just an example of being a good nurse, being on the ball. You're the last line of defense. You need to advocate for your patient. So, that's my good deed for the day. And yeah, it's about noon. All right, see you later. Hey guys, so it is 2 o'clock and I am getting my lunch break. You can look down here. I have my food that I packed. So I'm just getting a chance to eat, kind of relax. It's a holiday, so it's kind of nice. It's a little, I don't want to say the S word, but it rhymes with low. which is a nice change of pace. Progress on the patient. They're actually going to see if they can still discharge the patient today because they were able to do an EKG after the sotalol is given. So hopefully, if there's no QTC elongation, we can kick the patient out, and that would be wonderful because then we're not delaying discharge. And it is 4 o'clock, and I just finished my 3 o'clock assessments. So because we're in an acute setting, people change. So every 8 hours we need to do reassessments, and I just did one at 7, and then I just did one for 3, finished documenting. I went in, reassessed all of my patients. No changes, they're all good. Still no discharges, no admissions, although I did help with an admission. One of the other nurses was kind of getting swamped, so I jumped in and helped her do admission, and she was really, really grateful. And that's what nursing's about. It's about teamwork, being there for your co-nurses and being there just for each other. Sometimes on a day like today when it's nice, you know, it's helping out with an admission, and sometimes when you have something bad happen, it's just being there to give them a hug or a shoulder to cry on or anything. So in any case, I'm kind of a little emotional today because I'm on an oncology unit, and it's bringing back a lot of memories of my dad. Why I became a nurse was because my dad had liver cancer, and it's just been kind of hitting a little close to home. Some of my patients are just hitting a little close to home, if you know what I mean. But it's nice to be able to make them smile, even when they're in pain, and to be able on a day like today to pull up a chair and just talk to them for 10-20 minutes and really get a chance to be a nurse, to listen and to be there for them. So anyway, I'll check in with you guys later. I'm running down to the pharmacy to sign out a narcotic. Our policy here is that all narcotics are signed out by RNs. Hey guys, so it is 6:15. I am finally getting a minute to sit down and have my protein shake, which is my macro meal, and then also gonna have my fruit and nut trail mix. So I'm just eating something. So I'm gonna go to the gym right after I get out of work, so like about 7:30. So I like to try and sit down about 6:30, or like between like 5:30 and 6:30 if I can, just for a couple minutes and try and eat. It is so important to give yourself self-love. It is so important to pee when you need to pee, eat when you need to eat. I used to be an LRN, like a newly licensed RN, and I would not eat for 8 to 12 hours, not pee for 8 to 12 hours. I didn't take care of myself. I was exhausted. I didn't want to go to the gym. It is so important, guys, to take that time. It's 5 minutes. I mean, you can give a Lovenox shot 5 minutes late. You can chart, 5 minutes late. But you need to take care of yourself because you get one life. Live it right, because you would tell your patients to eat healthy. You would tell your patients to take care of themselves and pee when they need to pee. So don't be calling the pot the kettle black, or I can't even think of the saying. Don't be calling the kettle black or pot kettle. Okay, so I've been like 12 hours into a shift, so you can't hold me responsible for this. Hey guys, it is 7:30. I just finished giving report to the night shift nurse, and I'm about ready to get changed in the bathroom at work into my workout clothes, because if I go home, I'm not gonna want to work out because I'll be home already. So I'm really lucky the hospital that I work at actually has a gym here, so I get to just go there. So I'm gonna get changed and then I'll see you in the gym. Hey guys, so I am changed. I am in my workout clothes and I'm walking to the gym. It is 7:55 and I just got to the gym. So I'm going to do my lifting routine. Should take me, give or take, about an hour or so. And then I'm gonna go home, shower. Definitely need to do that. I have patient cooties and I'll sweat. coated head to toe. Definitely gonna shower and probably have a light dinner and go to bed. It is 8:40 and my workout is done. I lifted like a boss. Well, okay, as much as a boss could lift after like 12 hours of nursing, but I feel pretty good. I'm gonna go home and shower off all of this sweat, germs, hospital nasties, and I'll check in with you after then. Hey everybody, it's 10 o'clock at night and I am beat. I'm getting ready to go to bed. So I ate dinner, I showered, put a little anti-frizz, argan oil, shine spray in my hair, a little moisture so it doesn't dry out and be hospital dryness. And then I'm just gonna turn in for the night. So thanks again for hanging out with me all day. And if you enjoyed this video, make sure to give it a thumbs up. If you have any comments, write them on down below. And, you know, keep transforming yourself every day and subscribe and be part of the Transform Nursing community. Bye, and thanks for watching.